Symptoms that would cause us to be concerned and hasten your evaluation would fall into several categories. With respect to the carotid arteries, which supply blood to your brain, you should recall the acronym FAST, F-A-S-T, which stands for face, arm, speech, and time. Symptoms that would trouble us would be numbness or weakness in your face, one side of the face. Numbness, weakness, clumsiness in one arm and or leg. Difficulty with your speech that is slurred or unintelligible. Finally, the time is important. With a timely care, we can reduce or limit the damage done by the stroke by being seen promptly in the emergency department. So if you have any of those symptoms, you should report promptly to the emergency department. Other signs that might lead you to a less urgent evaluation would be that your physician heard a noise in your neck when they listen with the stethoscope, or perhaps you hear a noise in your ear when you lie down at night. These would prompt you to be seen and evaluated. Aneurysmal disease is often much more sinister and less obvious. Some patients will present to us saying that, "Hey doc, when I lay down, I see my heart beating in my stomach." I'm not seeing the heartbeat, but seeing this aneurysm or dilated artery pulsate in the abdomen. That needs to be evaluated. Sometimes the aneurysm is found by your family physician on routine exam, but most commonly it is seen as an incidental finding on imaging done for other issues, often a CT scan or an ultrasound. But you can be easily screened for aneurysm with ultrasound techniques, which is quick and relatively inexpensive. Everyone over 65 should have a screening ultrasound to look for abdominal aortic aneurysm. Folks who have family members who've had abdominal aortic aneurysm should have a screening ultrasound in their early 50s. Finally, the category of peripheral vascular disease is by far the most common thing that we care for in vascular surgery. And this is usually, but not always, confined to the lower extremities. It can involve the upper extremities, arteries to your kidneys, artery to your GI tract, or your liver. But most folks have blockages in the arteries to their legs. And this may result in symptoms as simple as your leg hurts when you walk, to a dead tissue, such as a lost toe, or require limb loss. Most people would present early on with symptoms of claudication. Claudication literally means to limp. And what happens is your legs are fine when you're sitting still. When you go out to walk, your legs become tired or cramped, maybe in the calf, maybe in the thigh, maybe in the buttock. If you sit down and rest for a few minutes, the symptoms will go away. When you get up and resume walking, the symptoms will come on again. They may come on at a mile, a half a mile, a block, or 10 feet. The sooner they come on, that reflects more severe blockage. That can be easily screened by a test called pulse volume recording, where we measure the blood pressures in your arms and compare that to the blood pressures in your legs. Using that, we can get a very good idea of the degree of blockage that you have.